Hi, everyone, and welcome to this digital form of FAMcast, your preventative health awareness movement podcast. I'm Margaret Wallace Duffy, the founder and visionary behind Preventative Health Awareness Month every February and movement, because this is legacy change in healthcare in action, and therefore it's all year round. So we're in the middle of Preventative Health Awareness Month, and today is a special day in FAM, and one that's very near and dear to my heart and very close to my story. This is Hormonal Health Day and Endometriosis Seen, Heard, and Supported Day. So let me try to get through this without some tears, and let me be very candid. And then I'm going to introduce my beautiful guests that are on screen with me here today. Many of you that have followed me for years know that I've struggled with a severe chronic disease that has wreaked havoc on every aspect of my life. And for decades, I didn't really name it or claim it or talk about it because there was so much shame, embarrassment, and judgment around it. For years as a young girl, I went over a decade gaslit, misunderstood, and quite frankly, not believed because I didn't look sick. As a young girl with all kinds of aspirations, as a competitive athlete, and a type A personality that just wanted to push through, I just wanted to be like everyone else, but I wasn't. I was having excruciating pain. I mean, debilitating pain, not just with my period, but any time of the month. And it got worse and worse and worse. Now, my parents were my advocates, and they took me to doctor, to surgeon, only to always be labeled a hypersensitive only child, a drug-seeking teen, an athlete with a nervous stomach, and that it was all in my head. And I don't know how I found my advocacy voice at the ripe age of 19, but I was in a hospital looking eye to eye with a surgeon and saying, I'm not leaving this hospital until you find out what's wrong with me, because there's something seriously wrong. And I was right. I was diagnosed with endometriosis on that cold day, yet I had no idea. I could barely pronounce the name of it. And that was almost 40 years ago. Now, the sad reality, not a lot has changed in 40 years. And yes, there's a swelling up of conversation and advocacy, and I'm here for it. And just last summer, I finally named and claimed it boldly, because I started to become aware of different testing and technologies that are coming to the forefront. But more importantly, I knew I had a story to tell, and I needed to amplify this to help other endo warriors. And that's why we have dedicated a day in FAM to that. And so today, I am honored to have two people with me. One, you will recognize, Stephanie Vandenbush, a cherished ambassador who's been with us from the beginning. Stephanie is a incredible registered massage therapist, and I'll tell you that because I just had a treatment with her on Monday. Her skills are incredible, but what's even more important is her servant heart, her willingness to look at new technologies, collaboration over competition, and putting the patient at the center of everything she does. She's a community leader, and Stephanie has really taken hold of this endometriosis story, and you're going to hear about that in a moment. Steph, thanks for joining me.
Thank you, Margaret. Thank you for having me today.
And then Laura from Endo Outspoken. So this is the first time I've actually got to see Laura's beautiful face. We've had conversations online in private DMs because we feel a kindred spirit, at least I do, Laura, because any woman at any age or stage suffering with this debilitating disease called endometriosis, I feel a connection to. And you're one of those people. But you're also one of those women that have stood up and are speaking out despite your pain, despite your obstacles, because you want something different, not just for yourself, but for others. And therefore, you have started this Endo Unspoken. So what a privilege to finally get to meet you in person. I'm grateful for the online world to be able to do that. Welcome to the family. And tell me a little bit about your story, Laura, before we get started.
Well, first off, thank you very much for having me here today. It is an honor to be a part of this. I guess just to dive right into my story, very much similar to quite a few of the things you were saying. It took me about 17 years to get diagnosed. And here I am in my 20th year with still just as much fight and pressure to get help as the day I started. I've only had one surgery so far about 3.5 years ago, and I found it made my symptoms much, much worse, and it added quite a few. I didn't know this at the time, but I just had a general OBGYN do my surgery, and I had stage 4 dye. So it was all over my bladder, my bowel, it was inside of my vagina, and they just were not able to handle my stage. But I didn't find that out until very recently. So now I'm fighting for my second surgery, hopefully sometime this spring. But just like you, in and out of the hospital since I was 12, fighting, pushing, begging, crying, pleading for anyone to hear me and acknowledge the fact that I am not crazy. But even today, it's just as much of a battle to get help, other than the three that they always pressure, which is birth control, get pregnant, or have a hysterectomy. And my thought on all of those is, if you don't know what causes endometriosis, how are you curing it with these three things? And that's my biggest issue with it right now.
Thank you for sharing so vulnerably and so openly. And I hear you, and I support you, and just validate you, because it's very isolating. This disease can be very, very isolating and can cause so much mental and emotional trauma to women and their families, because it affects everybody. It affects your partner, it affects your parents, it affects your workplace, it affects everything. And it affects our system, because it costs our system money as disease progresses. One of the things you talked about, just get pregnant. I remember being told that at 19 when I wasn't with somebody, and the cruelty of that statement, I didn't know at the time, but because it's a big cause of infertility, and I always wanted to be a mother, that's a cruel thing to say to someone that may in fact not be able to conceive. Now, I am very fortunate. It took me 10 surgeries before my son. I've got 6 years in between my children. I had some failed infertility, but I rolled up my sleeves and got to work with a lot of things, because whether you have a diagnosis for endometriosis or adenomyosis or you don't, what I hope this day, and what I hope the preventative health movement will do, is to help stock the toolbox to really help women get into the driver's seat of their health, not just to find their advocacy voice, but to stock their toolbox, because this impacts the entire body, and we have to help you thrive and live well. You have endometriosis. I mean, for so long, I was told when she got pregnant, which is difficult, it would go away. And that's not true. Or when she went through menopause, it would go away. And that's not true. This is a neuromuscular immune disorder, and some experts are calling it acts almost like a cancer, because it's got its own blood supply, and it's excruciatingly painful, and it impacts every system of the body. So thank you for sharing so vulnerably, and I want you to know you're not alone, and I admire the fact that you're here with courage and grace, to try to help yourself, but to help others, so that we can change the future in this space. And we need everyone at the table to do that. And you're right, a general OBGYN doesn't get that training. It's not their fault, it's not their training. And so there's new technologies and new blood tests coming out, and people like Dr. Matthew Leonardi, who's doing incredible work with ultrasound to detect things sooner. So I think that's really, really important to talk about. Now, Steph, you were part of this equation. We're going to come back and talk about your petition here in a moment, Laura. But Steph, as an owner of an integrative and preventative health clinic, after this summer, us hosting an event together and just being inundated with over 80 plus women and their stories, it opened your eyes, didn't it, Steph, in a way, even as a healthcare professional, that you weren't prepared to even hear. You didn't know me. You've known me for several years, and you didn't know I had the disease until I wrote that blog. Tell me, as a clinician, why this matters to you.
So for me, you know me well enough, like perspectives and understanding. I have this need to kind of, even though I'm not experiencing something, I want to be able to understand and truly have compassion for people when I'm trying to meet them where they're at in their treatment. And us working together this past summer really opened my eyes, and to be able to be part of over 80 women's conversations and individual stories, it was just absolutely heartbreaking to know that just you guys have had a really long time till you found out, but the average is like 8.6 years until you actually have a diagnosis. And I think that's a lot what has inspired us to work on this endo toolbox, is the fact that, this past summer allowed me to have the opportunity to have people see on my website that I do scar release with the dolphin neurostim, and realizing how much scars impact, like they hold emotions in our bodies, and to be able to have the visibility of people seeing that that's something that that I offer here, that was able to give a lot of people relief, as well as have people on my table that I actually got to meet. And I only in my practice have met a few people that have told me that they have had it. And after speaking to it and realizing that there's a lot of people out there, and it's so incredibly vulnerable and no answers. And I just found it very interesting for how close we've gotten over the last 4 years. For you, I never asked you what it was that you spoke to, and I felt that you're a very open person and that you would tell me when it was the right time. And I just couldn't believe that that's exactly what it was when I read your blog. So thank you for sharing that in the first place, because it would have took a lot of courage to be vulnerable like that. But if anything, the conversation and the community that it's created around this conversation, I'm thankful for. And if there's anything that we can do to help people have a voice, which is, it was so interesting that Laura, I've signed a few petitions, and I'm not even kidding. Like, it was like a few days after in the summertime, I saw your petition, and I'm like, this is wild. Like, how is this happening right now that someone has a petition going for this? And I'm like, I have to talk to this girl. And, I had to, I couldn't find you anywhere on the internet. So I ended up making a comment in her petition. And then she was able to reach me. I thought, let's see what happens with this. But yeah, so it was amazing. So yeah, it's really opened my eyes.
Well, thank you, Steph. And yes, and we're gonna talk about that toolbox, because this is a robust toolbox that I'm really passionate about putting out there, because it's going to help so many women, whether they have a diagnosis or they don't, to help with symptoms, to help with vitality, and to, more importantly, to feel empowered. Can we speak really briefly to that, Laura, of the feelings of often, and I don't want to put words in your mouth, but disempowerment, because you just don't know what to do. What has it been like for you, and how important would it be for you, even 10 years ago, to have a toolbox full of education from everything from somebody like Dr. Christy Prowse, an OBGYN and functional medicine doctor, who opened the Institute for Hormonal Health, was my hormonal doctor, and honestly has helped to save me in a lot of ways. She is contributing to this endometriosis toolbox, talking about the surgical implications, talking about the different medications and hormonal treatments, but then also looking at all the lifestyle things that can impact endometriosis, because inflammation majorly impacts. And then scarring, we're going to have that, and other technologies. This is going to be a toolbox like no other for the average everyday woman, so she can be empowered. What does that mean for you as an endo warrior?
That means absolutely everything to me. And I'm going to try to not get emotional here when I talk about this. But when I first got my period at the age of 12, the Laura I had known, the Laura that my family had grown up with, she was dead. She was gone. And I don't know if I'm allowed to say this on here, but over the last year, I had been contemplating with my mental health of taking my own life. yeah, my world stopped. I've heard a little bit about your story and the severity and what it's done to you, and I'm lucky to be one of the people to say that I have not had as many horrible things that have happened to me have happened to you. But of every day of going to the doctors or hospitals or urgent cares and being told that my labs are normal and that I'm fine and that I'm a liar or I'm a drug seeker, or everything that you spoke about earlier was what was noted about me. And the pain, the fact that endometriosis is labeled as just a bad period or that it only affects you on your period is one of the biggest myths and one of the things that completely enrages me, because it's every day. And because of that, I have a full-time job. I do mold remediation. And it's supposed to be a full-time, good-paying job. I'm low income and I almost lost my job because of the amount of time I have had to miss. And, I'm 32. I want to start a family. And 2 years ago, after trying for years to get pregnant with my husband, I had an ectopic pregnancy, and it was just devastating. And we've been trying to go through IVF, which has been an absolute nightmare. And there's lots of red tape that they don't tell you about for that one government-funded IVF cycle. And being low income and then being told that you need to get pregnant to fix your endo, it's just completely mismatched. So I think having a toolbox like this would be not only life-changing, but life-saving for many people who are just like myself.
Well, first of all, Laura, thank you. And I want to say this very candidly and publicly. We never compare our stories because they're all as valid as the next. My suffering is no worse than yours. And what I do feel, though, is I want to create a community, a connection, and with the family, PHAMILY, an inclusive place for people to be, as I called this day, heard, seen, and supported. I'm really sorry to hear that you've been struggling with your mental health. I'm not surprised. And I hope that and want to make sure that we can connect you if we can to anybody. If there's always a reason to be here, and we want to get you the help you need because you deserve to be here. The world needs you. But I do understand the depths of despair and the loneliness and the shame and the absolute devastation that this disease can bring. So thank you for being courageous to even share that, because there's a lot of judgment. And you're absolutely right. I mean, I self-employed from the minute I opened, and I can tell stories, and I'm sure some of my patients will be watching this. I remember being on my hands and knees. I'm a massage therapist. I had my own clinic. If I don't work, I don't get paid, and I had an overhead. And I remember having a full-on bowel obstruction and dropping to my knees and crawling out of a treatment room with the person on the table. I'm going to name her Ann Bell because you're a doll. She understood me, and I ended up in hospital. And an hour later with a nasal gastric tube down my nose. Not because I was trying to be a martyr, but because I didn't know what else to do. I was trying to live. And because I also had to pay my bills. So I know the impact it has on every aspect of life, financially and otherwise. So I think these are the hard conversations and the real conversations we need to have about this disease. And I'm not sure, I'm grateful for the scientists and the surgeons like a Dr. Matthew Leonardi, and there's others that are doing tireless work to bring this to the forefront. But we also have to have the voice of the endo warrior, because it's pervasive disease that impacts so many things. And that's why we really felt empowered to bring a toolbox that, regardless of whether you have a diagnosis or you don't, that we can stock your toolbox so you feel like you can do something. And so let's talk about that now, Steph, because I'm really excited. You talked about, scar work. Scars are not just physical. Yes, surgical scars and women with endometriosis, we certainly know about that. We have surgeries, and that can cause scar tissue. But emotional scars are also something. And our nervous system regulation is another thing. And our mental health. is another thing. And all intertwines, and what we eat and inflammation in the body, really looking at this from a holistic perspective. That's what we want to do with this endometriosis toolbox that we want to put out. And we're still working on it, and it will come. And we want to get people to sign up for this so that we can help empower. Steph, let's talk about that. And I know with Dr. Christy Prouse and others, we've got to, we're going to weigh in on nutrition. We're going to weigh in on testing. We're going to weigh in on surgeries. It's just going to be a guide. It's not even just a toolbox, but a path forward and a guide. You're also working on MPS, dolphin, and acupuncture specifically. That helped me tremendously and still does to this day. Can you speak to that?
Yeah, so I've actually been working closely with Susan, a registered acupuncturist here at my clinic, because I'm not a registered acupuncturist. And so leaning in, collaborating with other healthcare professionals elevates us all, and it also elevates the treatments that we're able to provide the people that are looking for us for help.
Yes.
And so, I just appreciate being able to do that. And so because of her knowledge, she's been able to kind of help me break down the layers of the way to apply those acupuncture points, as well as the impact of why each one has been incredibly helpful. And I think that for me, again, I'm going to speak to the fact that being a resource, whether or not I'm the person that can do something for you, it's not about me doing something for you. It's about me knowing if I know someone else that can help you. And so just understanding, because that talking about endometriosis, all of a sudden, then I start talking to different people, and they're like, some of the endo warriors I've met through doing the scar release, their lifeline is their registered acupuncturist to be able to help manage their symptoms, their hormones, all of those things, but also the toolbox to empower people that maybe don't have the ability to have the benefits that cover those sorts of treatments, or just allowing you the opportunity to see what's out there. And, one of my favorite sayings is do what you can with where you're at and what you have, right? So there's an idea of shooting for the moon, what would be the perfect thing. But, if it comes down to understanding what foods you can maybe change about your diet, how to regulate your nervous system with maybe some boxed breathing. There's a lot of free things that you can do. And just to be able to have, for me, I just want to be able to properly advocate for people. And if I can be a part of their journey into feeling better and providing them with information to be able to, move forward into figuring something out for themselves, I'm happy to be a part of that.
Well, and that's why you're a cherished ambassador. And that's what this is about, is breaking down the silos in healthcare, having allopathic conventional medicine and complementary, notice I didn't say alternative, healthcare professionals working better together, but with one mission: to put the everyday person at the center of their care and empower them with tools, strategies, resources, and access to care. And also advocacy, which brings us to the point before we finish up here tonight, and this won't be the last one we do together. But Laura, you've started a petition. You've done many different petitions, and nothing I love more is legacy work and creating change by banding together and breaking down silos. And even when it's hard, especially when it's hard and you're being told no, we need to push from the top down and bubble from the bottom up with everyday people. And that's where change happens. FAM is a perfect example of that. I started this by myself 4 years ago, and now over 88 healthcare professionals, FAM flags being raised in different municipalities, and proclaiming Preventative Health Month in different places, and being talked about in the House of Commons, and attracting 88 plus healthcare professionals because they all want to change the legacy of healthcare. And endometriosis deserves to be at the center of that conversation. So tell us about this petition and how people can get involved, Laura.
Where do I go with that? Yeah, so I started this petition. It's currently in the midst of the House of Commons currently. So please go to change.org and sign Recognize Endometriosis and Adenomyosis as Disabilities in Canada. It's a bit of a mouthful, but you'll find it there. And everything we're calling for are things that the majority of other countries are already doing. We're fighting for 3-day-a-month period pay. We're fighting for more funding towards research, which we desperately need. And I'm fighting for top-notch fertility care, which only a few places around the world are doing currently. But we're fighting for IVF or IUIs or whatever needs to be done until 2 successful children have been born, because everybody deserves a chance at a family.
Yeah. You know, it's hard enough to advocate for something when you are pushing a ball upstream. It's even harder when you're doing that when you're suffering yourself. So I just want to publicly acknowledge the courage, the strength that you have in doing that. And often change comes from people that have a story. And clearly you do. And I just want you to know that this preventative health awareness movement, this family sees you, hears you, and is here to support you. That's what this day is about. This is just the beginning, and we will continue to amplify our voices together. We will continue to stock the toolbox of Canadians and surround them with resources so they don't have to feel alone. And we don't have to have all the answers. And I'm not being Pollyanna. It's a very complex disease. It's not something that we can change overnight. And I know that. But we do have to have these hard conversations in order to create change. And Laura, thank you for going first and doing that with regards to here in Canada. And FAM will be right here with you, because this is how we change the future for all women. And that's really, really important. Ladies, so stay tuned. I'll make sure I put the petition in the caption so you can go there and sign. Stay tuned. We're also going to ask that you reach out if you comment on this video if you want to be on a list for when that endometriosis toolbox is released. If you are a doctor, a sonographer, a pharmacist, a tech person, anybody in healthcare that feels compelled to help women with endometriosis, join the family, be part of amplifying this voice, because there's not one answer, there's not one practitioner, there's not one solution to this complex problem. But together we can carry a really tough load. And all I hope for is that those years of suffering are shortened, but more importantly, the life that is lived with more vibrancy comes from the tools we put in an endometriosis war toolbox. And that's why I spoke up this summer. And now that I have, you watch. It's going to continue. So thank you, Stephanie. Anybody wants to know more information about stimulation therapy, scar work, it is a game changer. I'm highly trained in it as well. I'm just not treating like Stephanie does anymore. Know this, that many insurance companies cover the microcurrent point stimulation therapy device. If you want to have treatment with a professional like Stephanie, or reach out to somebody like me that I can show you, but then we can put this in the hands of everyday Canadians, of endo warriors, so they can help treat themselves at home to reduce pain, reduce inflammation, downregulate the autonomic nervous system, stimulate the vagus nerve, help with scar tissue. It is a game changer. And if you need an estimate done for insurance, reach out to me. We are here to help, and stay tuned because we're going to continue this conversation. Thanks, Laura. And know that we're here for you if you ever need anything, and we're in your corner.
I will. Thank you for having me on your show.
You're welcome. Thanks, Steph.
Thanks, Mark.
And I'm sorry we tried to do an Instagram Live, everybody, but sometimes you got to pivot, because that's what we do when making sure we're trying to make a difference. And remember, a healthy tomorrow begins with prevention today. Empowering people to become the CEO of their health is my mission, but it's an all-inclusive mission, from pregnancy through to palliative care and everything in between. So let's help people get into the driver's seat of their health, all of us. So the future is more health span, not just lifespan in this country, because we all deserve it. Have a great day, everybody. And remember to follow Become the CEO of Your Health. Subscribe to the YouTube channel, Preventive Health Awareness Movement, Become the CEO of Your Health. And follow us on Instagram, Become the CEO of Your Health, as well as Facebook. We're trying our best to give you as much free education and connect you with resources with all these ambassadors. Until next time, be well.